Hello, good evening, everyone. Good evening. This is Raised with Purpose. And as promised, today I have Miss Caroline Calloway here with us, who has information for us. Breast cancer information and awareness for us. Next month is Breast Cancer Awareness Month. So we just went ahead to put it out there so that everybody will know what is going on. So before she comes on the show, I want to say a little prayer, and I will definitely bring her on as soon as I'm done. Lord, thank you for today. Thank you for what you're about to do. Thank you that it's going to be a life-changing experience that we will never forget. In Jesus' name, amen. I'm about to bring Miss Calloway. Miss Calloway, I'm adding you to the stage. Hi.
Hello.
Hello, Miss Calloway. How are you?
I'm doing good. How about yourself?
I'm doing wonderful. Thank you so much for joining us today. I'm
My
sure I
pleasure.
have put it out there, not on Facebook, but to individuals, that today we're going to be talking about breast cancer awareness. And I told you when I spoke with you, I said the last time you were on the show, you talk about breast cancer awareness.
Yes.
I benefited from it. When
Mhm.
I remember when I went to do my mammogram in April, and they told me that I had to come back and do diagnostic testing or exam.
Mhm.
And I call my insurance and I'm like, man, this is not gonna work, because I am not going to be able to, or they wanted me to pay, like, it would have cost me about $2,000 or something like that. But I thank God that we already had a relationship, and I already had the information I needed. And when I called you, you did not hesitate. You made the appointment for me, and I came out okay, but I also came out debt free because it would have cost me a whole lot of money. So I want to thank you. Thank you
Mhm.
so much
You're
for
so
delivering
welcome.
on your word.
I'm
And
so
I
glad
hope
you're
and
here.
pray that anyone who is watching us tonight, or who will watch tonight, will remember when they need a help, or remember that there are so many resources out there, so many things out there that they can use or they can tap into when they need help when it comes to breast cancer. I'm sure there are others as well. So welcome,
Thank
Miss
you.
Caroline.
Thank
All
you so
right,
much. It's good to be here.
it's good. I don't know if your volume can be adjusted a little bit. I think it's a little low.
It's too low. Okay, hang on. Let me
It's,
see.
yeah.
How about now?
Yes, that is way better. Thank you
Maybe.
so much. So I'm gonna let you introduce yourself. How are you doing today?
Okay, so it's Sunday. I'm doing great. I had a short weekend. Oops,
Okay,
sorry. Hang on.
you fine.
I can't take this out of there. Okay, now.
You
Um, I,
fine.
I worked yesterday. We had an event
Okay.
at Alexander Park in Lawrenceville.
Oh,
It was like a field day for families, and it was really good. I
I didn't know
enjoy
that.
it. I had two ladies that need our services, and I put out the information about the health department.
Mm.
And today we went to a Hispanic Heritage Festival in Smyrna.
Oh,
I just wanted to go to eat the food that I like from my country. So Puerto Rico was there, and the food was really good.
oh wow. So you
Mhm.
ate, you get to eat. You got to eat.
Yes.
That's awesome. That is
So
awesome.
did you?
I'm
Okay.
glad that you did.
Yeah, it was wonderful. Would you like me to start with the presentation?
You can. I want you to talk a little bit about yourself.
Okay.
I want people who are watching or who will watch later to know who you are, what you do, and what you can make happen.
Okay.
Because that is one of the reasons why I spoke with you and I said, please come on the show to tell people there are things out there and you can make it happen. Because you made it happen for me. So go ahead and tell us a little about yourself, what you do, and we can just go on with the
Oh,
presentation.
okay. So
Thank you.
I'm from Puerto Rico, but I've been in the Georgia since 1998,
Oh wow.
and I've been doing this job specifically like
Mm-hmm.
9 years or so in total. It is really a good job. I love my job. It's so rewarding that I could be out there and help people, women especially, to get these services that can save their lives. Getting the breast cancer screening on time and the pap smear on time. Um, let's see. I am a mother of three young ladies, adults, and recently grandmother, two grandkids.
Congratulations.
Thank you. I'll show you the pictures when I see you in
Please
October.
do.
They're adorable, and they're gonna come here in October. I get to spend some time with
That's
them.
good.
Mhm.
That's good.
So it's just me and my husband. I send him to the room so I can,
You
but
you
he's
can have
seen
your
me.
time to yourself and
Yes,
the
but
room
he's
to
seen me.
yourself.
I've done events, and he's been with me before, so he knows how it
That is okay.
is. Yes, ma'am. Um, so the program kind of changed a little bit for the best, for the better.
Good.
So now there's no income limits. No income limits. You can make a lot of money and don't have insurance. We help you. Or you have a higher copay, and we will assist you on everything.
I know.
October is approaching. Next week is the Breast Cancer Awareness Month, and it's very important for everybody ages 40 and up to get a mammogram. And if you're younger and there's something wrong, you need to go and get it checked up, because prevention is the key. Getting things on time is the key. Don't wait for that. Let's see what else. I don't know.
But you work with the health department
Yes,
and you are, go ahead.
Gwinnett, Newton, and Rockdale. We have 3 locations in Gwinnett County. We have Lawrenceville, Norcross, and one in Snellville.
Okay.
That's brand new. The one in Snellville. It's beautiful.
It
And
is?
it's in the same place where the senior center is and the public library. If you ever in that area, Bethany Road, that's where
I
we're
know Bethany
located.
Road. Is
Yes.
that why they are trying to start the school? I think they want to start like Head Start or something pre-K.
I
They want to
don't
bring a
know.
school.
But if you go, you get impressed, because everything is so nice and it's beautiful.
It's perfect.
It's perfect, yes. And we have a lot of changes. We're trying to get more nurses aboard. So sometimes it's hard, for me to get appointments to come to the health department. But we're doing the best we can, especially for the ladies that have there's something going on. Those has priority, and we always work them in to be seen at the clinics. We have a clinic in Conyers and also in Covington. Okay, those are the 3 health departments. Like when I go out to the community, I can only go to Gwinnett, Newton, and Rockdale.
Oh, okay.
You know what I'm saying? Yeah. Because this program they have it all over Georgia. Are you there?
Yes, I'm here.
Okay.
I just want you to have your time and talk so that people will focus on you. I'll come in. I'm here. Don't worry. I'm here.
Okay. What was I saying? Okay, this program is all over the United States.
Here I am.
And we have it in Georgia. And these people call me all the time, and they live in Marietta, or they live, I don't know. I connect them. I know the Kelly navigator for Cobb County. She's really nice. So, and I even get calls for other things. Like, did you know this and that? And I'm like, I don't know.
Yeah,
But
I know. I called you about something else the other day. She's like, I'll just send you the link.
I'll just go and Google. No, but people are very thankful. The ladies that we help, they're like, you have no idea. Some of these ladies, I know them from 2017, and they still come to the health department. Can you believe that?
Wow. And now they are calling you.
We're still in touch. Yeah.
I'll keep in touch with you till whenever we all disappear. But it's a good connection to have, because when somebody approaches you and they have a need that you can help to kind of take care of, I believe that is a good thing. So to have you and to say, hey, I know Miss Caroline, call her, it is just a blast. That's why I can't wait for you to come to my job and also tell them about your program, because I want everybody to hear about it. I just want the world to know that
Spread
there is
the
help
word, the
out.
news.
Yes, there is help out there. You
There
don't have
is
to be alone in this walk.
ex-
So there's
awesome.
help. People need to, especially our women, men too have breast cancer. I know you're gonna talk about it. They can. It's not as it's minimal, but they can have breast cancer. So yes, I really, really am excited about this results. But that is what I like, keeping the family healthy,
Hmm. Yeah,
and staying
definitely.
healthy. Yes.
So we Head Start is right there where the health department is in the second level,
Mm-hmm.
or for your members from the church, are they Gwinnett County?
Mm-hmm. They are.
Okay, okay,
Yes,
that's
they
cool.
are. They used to have like health fair. It didn't come on this year. I don't know why. I wasn't part of it. So I don't know. I will talk to the person who's in charge of the health department, or I
Yes.
don't know, and see what they want to do. Because I remember somebody saying that there was a time that they had I think it was, I don't know who it was. They were ready to come and do a mammogram on site, but they didn't have space. But now they do. So
It wasn't. It probably Northside. Northside does that.
I don't know. It was
Northside.
a long time ago. I wasn't even
Yeah,
part of
yeah.
the church anyway. I
Ah,
didn't go.
okay. But with
So I was
those,
told. So
with us, we have also a community outreach team that we go out in the community and they provide blood pressure. They check blood pressure, sugar, and they do vaccines. And we're
yes.
starting doing we just got the flu vaccine last week. And
Mm,
Saturday I was with
already?
them. Already. You can wait another month, if you want to. I just went ahead and got it.
Why not?
So,
Last time I think we had a fair and they came to my job and I got my flu vaccine that way.
oh, honey,
Through
you
them.
can you can always go make an appointment, go upstairs
Go
and get it.
upstairs and get it done. That's
Yeah.
definitely.
Yeah, because it makes a difference. Even if you get it, it won't be as bad as because I got the COVID and thank God I was vaccinated and it wasn't as bad as other people.
Oh, I got a COVID twice.
Hmm.
I did. So I got, when it first came, I got all the stuff, and I was traveling. I got the
Oh,
booster. I was like, I'm not, but yeah,
I
yes.
had it. I didn't know I had it. I was like, oh, this is just a cold. But thank
All
God,
right.
I did really good. Um, anyway, what else? Let's get started.
Not a problem. I'm ready when you are.
Wonderful. Thank you. Let's see. I never used this with this. How did you pull it out? Did you see that I have the slides on the
I can
bottom?
add it to the
Oh,
stage.
thank you. Yes, thank you. Thank you. Thank you. And then I can.
Trust me, it was just a trial.
Okay, there you go. There you go. There you go. So here's the breast anatomy. Okay. Sometimes, the 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 cancer is not necessarily in the breast. Sometimes it's in the over here in the lymph nodes. That's why when
Mm,
you get it, and I'm not a nurse or a clinical person, but it's always good to check your breast after your period, at least once a month, to so you get to know if there's any changes or
I
if you feel
see.
any lumps, you have to go and get that checked up. So, okay.
And if somebody for the first time needs an initial check, breast check, can you guys help?
Yes.
Okay, good.
So yes,
Good.
women starting at 40 is the recommendation that start getting mammograms.
Mm-hmm.
However, we have younger clients that had a problem. They're in their 30s, and we send them to get mammograms, and we either get it on time or it's too late. That
Oh,
happened
I hope that's not
several
going to be the
times.
news for anybody.
No, but that's what I'm saying. I just talked to a lot of people. I don't know how to convince them to go and get a mammogram. Some lady said, no, because that has radiation and it hurts. And I'm like, it doesn't, it has minimal radiation. The X-ray machine, I think it has, or the microwave has more. It's very, very minimal. So don't be afraid to get a mammogram.
I would rather get that than get anything else.
So, the cancer is basically, it's a disease when um, an uncontrolled division of abnormal cells cells, they develop in one part of the body. It could be, anywhere. And this specific, we're talking about breast cancer. And when they say the diagnosis is malignant, then that means that you have cancer. Or if it says they found lumps, is benign, is you don't have cancer.
Have
A lot of
anything.
ladies, sometimes the results could be negative, benign, probably benign, and then, cancer, and they put it on stages. Okay. Most of
Okay.
the ladies, it's a stage just negative or probably benign. And that only means that you have to come back in a year. That's why it's important to get early detection. So here's some of the symptoms that you can have. And unfortunately, sometimes there's no symptoms, but like when you look at your breast and you feel a lump, or your nipple is inverted, or you have like dimplings, the orange. I always use the orange like an example. You see the skin of the orange?
Mm-hmm.
That's if your skin changes like that, that's bad. That's one of the signs of cancer. If you have any discharge, redness, or skin changes, you have to go and get that checked. Okay.
Okay.
So in the United States, this type of cancer is the second leading cause of death. Number one is lung cancer, and then the second is breast cancer.
Oh
Uh,
wow.
yes, one in 8 women is going to have breast cancer, unfortunately. And I have some statistics, but I've left it at the office. Like, I don't know how many seconds a woman get diagnosed with breast cancer, unfortunately. So these numbers are good. These numbers were from last year. These are the amount of people that were diagnosed, 720. Out of those, 42,000 die in 2024.
Oh wow.
Mm-hmm. That's very considerate. I mean, and that's just in the United States. Okay. There are survivors, I meet them all the time when I go to my events. Fortunately, because they advance and people are more getting education and they know about this program, so they go and get it done on time. So in the state of Georgia, unfortunately, I couldn't find nowhere the numbers for 2020, but for 2024. But this is an estimate. About 8,000 women were diagnosed, and out of those, 1,300 passed away from this condition.
Oh
So
wow.
the risks are right there. The fact that we are women, the fact that we get older, and our race, it makes an impact on having a high risk factor. Older women, especially, don't ever stop getting your mammogram. This program is up to 64, but you should keep doing your mammogram every year. Some ladies that are older, like in the 70s, have told me, "Oh, my doctor said I don't have to get it," and I'm like, I don't agree with that.
You are like,
Personally, you should
okay.
get it. No. Mm-mm. All right. There's some risks that you cannot change. If you have family history of breast cancer or certain non-cancerous breast disease, some genetic mutations, having dense breast test tissue, women who took the drug DES, that is something they don't use it anymore. It was back in the 60s when I was born. I don't know, ladies were using that medicine, but not anymore. And some women that were on previous treatment using radiations, okay? Because, the cancer could start in one place and spread to another
Okay.
one. So there's things that we can do to, lower the risk of breast cancer. It's like trying to be active. Overweight after menopause is also, it puts you in higher risk.
Oh Lord.
Taking hormones, reproductive history, and drinking alcohol. Those are things that that can influence in getting breast cancer. Some things that are not proven. Some people say, oh, if you dye your hair, you're going to get cancer. That's not proof. Hair dyes, relaxers, antiperspirant, bras, breast implants, abortions, or miscarriage, it hasn't been proved that it's a risk. Okay. And this is the part where you go and get it. For the ladies that never had a mammogram before, that's how the mammogram machine looks. I know that is uncomfortable, but it
Oh,
just takes
yes.
place that 5 minutes. It doesn't take not even 5 minutes. It goes really fast. So that's how you have to be prepared. There'll be a technician and they'll put the breast in different positions, so they take different angles of your breast. Basically an x-ray machine specialized for that area of your body. It's best to do it after a week of your menstrual period, because that's when, after your period, your breasts are less sensitive.
Okay.
And when you go and get the mammogram, of course, you have to wear 2 pieces of clothing, no perfume, deodorants, or anything like that. Be prepared, because they said it lasts 20 minutes, but I promise you it doesn't last that long. The results, they come right away. They send them to the health department. I see the results all the time. So we get the results. If it's abnormal, we'll call you.
Yes.
Sometimes you have to go back. Like in
Nobody wants that. Nobody wants that. But it happens.
But
I've had that twice.
oh, see. So,
Yes.
but like some people, the radiologists see they look at the images and they said, well, there's something not clear here, and they will call you back. It's called callbacks, and you go and get it checked, and more than likely it's okay. All right. And this is what I was telling women that are uninsured or underinsured. They can have these services. We'll do at the clinics, we have nurse practitioners, we do the clinical breast exam, then we give you a referral for you to go to get your mammogram. And we have a contract with Northside Hospital and also Piedmont, those two. Okay. And sometimes it's zero cost for the consult, but the mammogram and all that is free. Okay. That's definitely 100% free, the mammogram.
That is good. That is good news. I like that you have it's free of charge.
Yeah, that's free of charge.
Really good.
So let's see. Yeah. No income limits, being a woman, living in Georgia. We want people that live in Georgia. We don't want anybody that lives in somewhere else and then she's on vacation and then she leaves to her country and has cancer. What are we going to do? So please, people that live in the state of Georgia, or I don't know, it's Georgia. That's the main thing. Or they can go wherever they live in. They live in the United States. They can go to their local health department. So 21 to 64 includes cervical cancer screening, and 40 to 64 is just for breast cancer. And it ends at 64 because at 65 we all get Medicare, supposedly. We get Medicare, so what's that the program cuts off that day at that age group. So you should start talking to your doctor when you're in your 40s and start getting your mammograms. You can from 50 to 64 every other year. However, that personally, I will do it every year. And I have talked to my doctor, and she said, no, I don't want you to skip a year. Now, if you're diagnosed with cancer, there are several things that can, to treat that. It's either surgery, radiation, chemotherapy, hormone treatment, target therapy, or immunotherapy, or biotherapy. If you are in our program and you are diagnosed with breast cancer, we will help you with the first steps to file for Women's Health Medicaid. We file the application for you. and then the patient is responsible for submitting the proof of income, proof that you live here. They have a list of things that you have to, but just they give it. They have it's called presumptive eligibility, and you have it for 30 days. You can start going to the doctor, any doctor, for anything. Okay.
And this covers what?
Everything. I mean, it could cover, I think, reconstruction and all that.
Oh, wow.
But this women's health Medicaid that they have is based on income and family size, income level. Okay, they are a little, restrictive. But there are other things, other resources like Cancer State Aid, Georgia Cancer State Aid. That's another assistance. And for women that I help they don't have legal status, I help them filing for directly with the hospital. All the hospitals have funds to assist people without insurance.
I see.
Okay, so try to maintain a healthy weight, eat healthy, don't smoke, limit your alcohol, be active. Those things they're good, reducing the risk of breast cancer.
That's good.
In summary, it is easy if you are diagnosed early stages. And regular mammograms can find that. See, because I know people have told me, well, I don't feel anything, and the nurse didn't feel nothing. Sometimes you can't feel it. It has to be through the mammogram, because the mammogram can detect like little bitty. They can detect anything, but human touch is not enough. So, I mean, American Cancer Society, is one organization that they give support. I used to work for them for 3 years. And I know they have a program called, I don't know if they still do that, but like if you need transportation, you can find out if they still do that. And also they have a facility that patient can stay there if they live far away from the doctor.
To be able to in order for you to
get treatment. It's called the hub lab
treatments.
Yeah,
that's interesting to know.
And that's all.
The American Cancer Society.
Yes, that's a good source for all types of cancers, not only breast.
Okay, that is good to hear.
So here's my contact information. I think I'm the only Carolyn in the health department. So,
Carolyn, you'll find you. When they say Miss Calloway,
yes,
they'll find you.
They'll find me.
And there are others you work with, right? It's not only you.
Well, I'm sorry. What?
Do they have patient navigators other than you? Some people that.
Well, for our counties, it's me, and they have another lady, but she's just starting. She just recently started. She's going to be handling the cervical part.
Oh, okay, that's good.
But I'm going to show her the ropes, show her what I do in case I'm not available, so she can step in. Yeah, okay. She's a nurse, actually. She recently started with us. She's really nice, and she helps with the cervical part. Okay.
That is good.
Very good. Can you bring out the other one? Do we have time?
Yeah, I'm going to add it to the stage. Yes.
Okay. This is the other fun part, cervical. Yeah, it's uncomfortable too. Here is, you can see the healthy cervix on the left, and here is that you have cancer.
Oh, wow.
Do you know that when you come to us and you get your pap smear done, and if your pap is found abnormal cells and positive for HPV, we send you to get a biopsy, and it's included on the program. You don't have to pay extra. Yeah.
Okay.
This program is awesome. I mean, yeah, we send you to get the colposcopy. So these are some of the cases. Every year is an estimate. 13,000, 4,000 passing away from that. This type of cancer, I believe, is very slow. That's why they don't test you every single year, because now with the technology, those pap smears they do, they catch up things. So you don't have to do it every single year. In the state of Georgia, is the fifth most common cancer. And those are, again, I could not find recent figures, but those are from 2023, 327 cases, and out of those, 204 women were diagnosed with. Now, let me make this a little big. Okay, there you go. Will die. So, or something that is so preventable.
It looks like it.
I don't know if you know, but the main cause of cervical cancer is having that human papilloma virus, the HPV. Most people have it. They don't know they have it. Most women get the test, and one day, oops, positive. Okay. When that happens, you have to go and repeat your pap smear in 1 year, because sometimes, our body gets rid of the virus by itself. But when it stays in your body, that's where it's not good. It's because it's dangerous. So here's some risks, like smoking, using birth control for more than 5 years, having several sexual partners. Those are, they put you at higher risk.
Using birth control?
Yeah.
Is there any particular birth control?
The pills.
The pills. You pop in the pills. All other ones are safe other than the pills?
Well, it all depends. I mean, there's so many types of
contraceptives,
right? And it all depends on your age, because we have ladies that are in their 40s. It all depends on your health and all that. Yeah.
But the pills is what is found to have some issues
on the pills
with cervical cancer. Okay. Well, we need to hear that, because that's important, because I'm sure nowadays we have other, should I say, options, but pills, people have used the pills forever and ever.
I don't think it's healthy anyways. It's healthy to have it for so long. I don't know. That's my personal opinion.
Hey.
Okay. So this HPV is very common in men and women. It's not only women. 14 million Americans, including teenagers, become infected.
Okay.
And some of those infections can lead to cancer. For example, these are the ones that are related to HPV, like cervical, vaginal, vulvar, penile cancer, anal cancer on men and women, back of the throat in men and women. Those are all the HPV-related cancers.
I see.
And how you pass it, well, is through sexual intercourse, oral, anal, vaginal, skin-to-skin sexual contact. That's how you pass that. However, like one of the nurse practitioners was telling me, it's not the same as like if you're diagnosed with gonorrhea or syphilis. It's not the same type of disease. That's what she said. Fortunately, we have the vaccine, and we have it at the health departments. Children starting at 11. 11 before 15 is 2 doses. After 15 is 3, and they extended the age group to 45. Now, it's recommended to have it when you're young, because you have your immune system. It builds your immune system. So after, I have ladies that have they had HPV vaccine done after being tested positive. So the vaccine will protect, because there's a lot of types of HPVs, and it only will protect the ones that she hasn't been in contact.
Oh, okay.
Okay. So this is a safe vaccine. It's being 90%, prevents this type of cancers. Over 1 million doses, maybe now more. And the side effects are like when you get a shot, like you have soreness, Maybe you have a little fever, nausea, muscle or joint pain. That's very common. And here's, the vaccination, 11 to 12, screening opportunities. So the screening for HPV starts at age 30, by the
Oh,
way.
wow.
Yeah. So here's some symptoms of cervical cancer, like initial vaginal bleeding or initial discharge or pain. And sometimes there are no warnings at all. Also, women that are already have menopause and start bleeding, they need to go on to the doctor because that's not normal.
After you stop getting your period,
Menopause, when
and your
when your period,
menopause, okay, and you start seeing blood, sometimes it's something that's telling
there's
you
something going on. Yeah.
something's going
Yeah.
on. Okay.
So menopause woman is considered a woman that haven't been with a period for one entire year.
Mhm.
Yes. All right. So, to decrease the risk,
Excuse me.
decrease the risk of cervical cancer, of course, getting your screening test done on time, PAP and HPV, getting the vaccine if you don't have it in your age, and you're within the age group. Don't smoke, use condom, and limit your number of sexual partners. And here's we already talked about this, the dosage. I don't know if you have people, younger ladies, but this is how they do the pelvic pain, the pelvic exam is done, and it's supposed to start at 21. Even if you never had intercourse, you can have this done, and they will do a pap smear at 21, which is basically we collect some cells and from the cervix, and they send it to the lab, and we usually get results within 4 or 5 days with us. Okay. Before having your pap test, it's better not to have intercourse before. Don't use anything don't put anything on your vagina either. And here are the recommendations from 21 to 29, and then from 30 to 65, continue, but with those two tests. They say that if you're 65, you can discuss with your doctor to stop getting those. For example, women that never had an abnormal pap smear, they can stop. Women that don't have the uterus, they can stop. However, if you were diagnosed with cervical cancer, you have to continue for a period of 20 years
Oh,
getting
wow.
tested for this. But if it's not for cancer, you don't have to.
Okay.
These are the diagnostic tests that are included. If your pap smear comes back abnormal cells, we'll send you to get that colposcopy, which is like a biopsy, basically. And also we have the cervical biopsy. Those are included in the program and cover because it's going to let us know what's wrong with those cells. The cells, the pap will tell you abnormal cells, but we don't know. We have to go further and get this test done, the colposcopy.
I see.
If you're diagnosed with cervical cancer and you're coming through us, we can also help you get Women's Health Medicaid presumptive eligibility. Presumptive means that for 30 days, you're going to have insurance, but you have to follow up with DFACS.
Oh, okay.
You have to follow up with them. They're going to send you a letter saying, we need you to provide proof of income and, all those things I was telling you. And they'll give you you'll get medical, and you get for medicine too.
That's good.
Early detection includes, getting the vaccine if you have the chance, pelvic exam, pap test, and HPV. It could be preventive. This is a cancer that could be prevented to those tests successfully if especially detected early. So see, the survival rate is 92% on this type of cancer.
That is very high.
Again, the same requirements. Being a woman, live in Georgia, insured with a high copay or deductibles, uninsured, in that age group. Uh, those are the eligibility to have this to be able to participate. So if you come to us, the pap smear and the HPV is no charge. That's included 100%. Now, if you're a younger lady and that you can still get pregnant, there'll be a cost for the consult, but not for the test. And they test for chlamydia, gonorrhea, and syphilis, and HIV too. Okay. All right. So this is, again, have your pap regularly tested on time. Some women have to come back in 6 months. Some women have to come back in a year. And part of my job is reach out to these ladies and say, hey, it's time for your pap smear. And, and then I'll set up their appointments and I bring them to the clinics. So I follow up with those ladies. I follow up with the ladies that are 6-month follow-up for breast mammograms or ultrasound too. And we have lots of patients. Again, the American Cancer Society, and here's my contact information. I'm looking forward. We have a lot of activities going on now in October. It's going to be a very busy month, which is good. And I encourage the ladies that are listening or will listen to this message to please don't just go and get it done. Don't think about your health, think about your family. Okay. There's no reason to say no, I can't do it because I don't have the money, but we help you. Even if you don't have the money to, I don't know, pay the consult, we will assist you. We want to see as many ladies as possible to prevent and detect breast cancer and cervical on time. This is a fabulous program that not only includes diagnostic mammogram, includes also biopsies. We have a lot of ladies who get done biopsies. We send ladies to go and see the breast specialist also. So, yeah, that's it.
All right, I'm going to go ahead and remove these from.
Yes, ma'am.
Good, so that you can come back to where we were. And I really, really appreciate you taking your time to be on the show because, like I said, I benefited from it. So I can't say that I'm sending people to a place where I have no clue if things are going to work out. I remember I told you, I think it was, I called you somewhere in, I think it was May, and I said, Miss Calloway, I need help. And you did not even hesitate. You pick up the phone and you made a phone call. And, and I went through it and I didn't have to pay anything. It wasn't like you, and then you sent me to where I began. So it wasn't like I didn't know the place where I was going. It wasn't like you just put me with anybody, just anybody. It was just legit. So I say that to say that if you are watching or if you're going to watch in the future, or if you ever would need some help with breast, even if it's not cervical cancer or breast cancer, I'm sure when I needed information, you just sent some things to me.
Yes.
So I want to encourage us all because this program is about the family. And if we are not healthy, we're not going to be able to take care of the family. When we are sick, whatever it may be, especially cancer, once somebody tells you have cancer, it's like your world just falls apart. Just the fact that they said cancer. They tell you have a headache, it's okay. Stomach ache, you nothing. Now they say you have cancer.
That's
That
me.
is to me, for some or for all of us, it's like a death warrant, but it doesn't have to be so. If we
Mhm.
get early, we will get our yearly checkups and follow through with doctor's recommendations and eat
Mhm.
well. And you said something, said if you hit menopause and you're overweight, I said, oh Lord, I need to start losing some weight because I you never know.
But if
But
you're healthy, as long as you're healthy, you feel good. You
yeah,
know.
yeah, but if you are overweight, you may feel good, and I'm not saying I'm overweight, but you may feel, but it's all around good to exercise. It's all around good. As you age, your bones become brittle, so
Mhm.
you want to work out and exercise, even if it's walking. You don't have to go to the gym if
Yeah.
you don't want to. Do
Yeah.
something because it helps also when it comes to preventing breast cancer and or a lot, I'm sure a lot more cancers, and
Oh
it's
yes.
a lot leukemia or every organ in you can be cancerous.
Mhm.
And it's, I think I can say that bladder cancer, I mean whatever, lung cancer, brain cancer. So our body is a very complicated thing. I say it. And anything and everything can affect the body. But if exercising means that you can prevent it to some extent, I think we need to get together and we need to make it work. But if for any reason, one or two reasons, you've been diagnosed or you need help with going back for what I went back for, diagnostic exam,
Mhm.
then by all means, get in contact with me and let me help you find Miss Calloway. Hey,
Mhm.
put her
Yes.
number on there, and
Mhm.
I have a number, so I will connect you so that the program is there for everyone. It's
Yes.
free
It's
if you
free.
qualify, and qualifying is not hard because I've been through it. So now today I can talk from experience, and it
Mhm.
was a beautiful experience. I love the nurse, the one who did my exam, and
Yeah, they're
called
all
the
nice.
beautiful lady.
Mhm.
So don't be afraid if you are undocumented. There is a
We
way.
don't ask for documentation.
Yes, for
Mm-mm.
as long as you are a woman and you need help, call the health department. And
Yes.
they have this everywhere, right? All health departments should have this program.
Yes, ma'am.
Oh, that is wonderful.
And if you don't know where to go, I'll find out.
I see that.
I
You love what you
will
do, and
find
that
out.
is beautiful.
Yes.
Together, right? We
Mm-hmm.
will find out. It's out there for you now. You have seen how often you need to get tested. And I love that you said that even if you are 64, even though this thing ends, the program ends, you still have to continue when it comes to breast cancer. Because
Mm-hmm.
the body is, I mean, as soon as they tell you something, then your breast starts telling you something else. That was how I felt. I was thinking about who's gonna take care of my children, who's gonna take care of my family. I have a husband, I have a household. What how are my children gonna survive? How am I even gonna tell them that something like that happened? So don't sit there and die if you can prevent death.
This is so
You're gonna
very
die one day, but don't die prematurely because you didn't do what you
mm-hmm.
were supposed to do.
As
So I don't know
long
if you have anything else that you want to add. And
I
I'm
hope that I
blessed.
can at least reach one person to call me tomorrow or this week. Hey, I saw
Yes.
you. I need help. That will make my day.
Oh, okay. So if you
Yes.
are watching, we want to make Miss Calloway's day because she's gonna keep coming. And like we said, next month is a whole month that's set aside for breast cancer, right? To
Mm-hmm.
talk about it, to discuss it, to not be afraid to talk about our breast and our body parts. Cervical cancer, but I think it's breast cancer. But next month, so if you haven't done your mammogram and you are 40, next month at least do something next month. Give me a call, DM me, and that what they say. Send me a task. You know me. You can find me on Facebook. Say Wabo Sue. You know. Just or maybe next week when I come back, I have something to say. You can also say, "Hey, I'm looking for Miss Calloway's number." If it's your friend, connect. We just want women to live a healthy life, to be healthier than we are, to get to know that there is support out there, It's a no judgment zone. Nobody's gonna
Mhm.
judge you. Nobody's gonna ask you for, hey, how long have you? It doesn't matter. I've been through it. I've done it. I've been a recipient of their services, and it was fantastic. It was fantastic, and I want to tell people, and I have insurance. I actually have a good insurance. My job gives us very good insurance, but still, I was gonna pay for the deductible, which was gonna be over 1,000 and over, almost $2,000, and I didn't have to pay that. It was too high, and I did this for free of charge. So it's worth your time. It's
Mhm.
worth your energy. Do it for yourself. Do it for your family. Do it for your children. Do it for your community. Because when the individuals are healthy, if we have healthy individuals, our community is healthier.
Mhm.
Because we can all do it together. We can come back together without having to worry about sickness. It is free, y'all. It is free.
Yes.
That's what I want to say. But Miss Calloway, I don't know if you have anything else to say.
That I mean, thank you for the opportunity for me
Oh,
to tell us about the program, and you keep doing what you're doing, girl.
oh,
And
thank
I'm gonna
you.
see you soon in October.
October 15th, right?
Yes,
We are
ma'am.
excited. I have the ladies, they are rallying, they are waiting. And
Mm-hmm.
hopefully one day we can do some mammograms like on site. That
On
would not be a bad
site.
idea. The school. I don't know
Yes.
who needs it, but who is not able to talk because they are afraid. But maybe that's something that we can look into so that other women or women who need this bad. So I don't know how to even say it. Some people need it. We may not know, but we need to think about it, and then they can know that they can have it for free. So hopefully, when I see you on the 15th in person,
Mm-hmm.
and this I'm gonna have the projector ready, we will be able to get some women who might need your services.
Yes.
Yes, ma'am, and I will do. It's October, so my goal is to at least find you one woman, at least one who is
Mhm.
willing and able and need to see somebody because it is out there, believe it or not.
Mhm.
Someone just said 10 women. That is not bad. That's not a bad goal.
Hey,
That's even
yeah.
better.
I mean, the more
That's
the
even
merrier.
better.
Yes,
Yes,
even better.
ma'am. Yes,
Yes.
and I'm gonna start talking to those who are responsible for certain things and see what we can do.
Mhm.
And in the future, when you have all these, what should I say, activities and events, let me
Mhm.
know. Let
Okay.
me know. I can put flyers out there and I can send
Okay.
people you because I didn't know about all this because our job could have been there too. But really honest, because you guys do a lot of outreach. We don't do it. We
Yes,
can.
I think last year, the year before, the mobile unit went there to get the children vaccine back to school.
They came to ours. Yes,
Yeah,
I got my
the
shots
computer
from there.
center. Hmm.
Yeah, I got my flu shot from there. So
Yeah.
yeah, they were beautiful. They even found somebody had an elevated blood sugar level that they had to
Oh,
send to the emergency room.
or maybe it
Yes,
was high
yeah.
blood pressure. If you come
I
to
don't know
us
what it was. It
and
was
if the blood pressure is up, we call it
yep,
911. You have
yep. They said the person couldn't go home,
to see
and
it's dangerous.
they had to. And when the person went, that was when they found out that their was it blood sugar or something was about 400 or something.
Maybe it was the well, I don't know. It could be
It
that or
was
it could be the
something,
blood pressure. Yeah, it was
but
something.
they saved the life on that day.
Hmm.
They did. So these things are important. These things are needed. And those of you who are young, I see one of my young people here, Angel. When you don't wait till don't hesitate to go and get all your mammograms and stuff done. If you feel anything, I know sometimes you don't want to hear the news, but it's better for you to find out what's going on now than to wait later on when there's nothing that you can do. Our body is changing always,
Hmm.
and we want to make sure that we are meeting the needs of our bodies, and hopefully we can prevent a lot of things, unfortunate events that we don't want to hear, especially
Yes.
when you have family. It doesn't matter. And I think if you don't have anything on this note, I just want to say you don't have anything you done, right? I have your information. I just want to say thank you.
You're
Thank you,
welcome.
thank you, thank you for coming on the show.
You're
We
so
we
welcome.
we, we seek to get the family healthy.
Hmm.
And trust me, when I used to talk to you, I never knew that I would need the help. I never
You
knew that
never
I would,
know.
because I thought I was doing it for others. And lo and
Hmm.
behold, I got a phone call. I think it
Wow.
was a week after I had done my mammogram. And they
Hmm.
said, come back. And I said, huh? And I called my insurance and they gave me the price tag. And I said, huh? I said, oh, no, no, no. Let me call Miss Carolyn. Carolyn.
It's yeah,
And
it's
I
a
was
shock,
like,
but when they say come back, I mean, you get. I got it one time. I got called back, but you get kind of scared. But then, like, okay,
you have to
to
go.
do it.
You have to go regardless. I didn't even tell my children. The only person I told was my husband and my prayer partners. I didn't even tell my children until I found out nothing was there. I
Hmm.
kind of sort of knew what they was, because before I went, there was this pimple that appeared in between my
Hmm.
babies, and that was what showed up on the test. So I kind of
Ah.
have an idea, but I also wanted to find out.
Hmm.
When I go, the lady said your breast is stabilized. I'm like, oh, okay. But
Okay.
I still needed to know, because there
Of
was
course.
nothing that I could have done other than going to get it done. So yes, I appreciate your information. I
You're
appreciate that you
welcome.
deliver your promises, because you did it for me. And I pray that you will find more people to help, just as you have helped me.
That's
And
my goal. Reach
yes,
as many people as
it's
possible.
the greatest goal.
Hmm.
You don't have to live in this county to reach out. If you
No,
call and we don't live in this county, she can
I
refer you
connect
out
me.
to the right person, or to the right department, or to the right place. So she
Hmm.
is there with information and she's dying to share them. So call me. Her number was on the phone. I have the number. I took a picture of it and I have it in my phone as well, her job number. And she will be more. If you have a church, or if you have any organization that you need someone to come and talk to women about breast cancer, because she's a specialist and she has resources. Because most of the time people have what they know what to say, but they don't have the resources to help you. But she does. So she's all in one. She's all in one, and she has been of tremendous help to me. So what happened? Yeah, so text me, call me, you know my number, email me, inbox me, do whatever, and I will get you to Miss Calloway. So thank you. I love to end by praying, because this is a Christian program, and I hope you don't mind. Can I pray?
Yes,
Lord,
please. I
thank you.
don't
Lord,
mind.
we thank you. We thank you for this program. We thank you that this program is out there to make sure that the family is doing well, so that we can better take care of our children and of our families and of ourselves. I thank you for Miss Calloway. I pray that, Lord, that you will send customers to her, not because they've been diagnosed, not because that something has been found, but before that even happens, I pray that, Lord, you will bring her more people, more customers, so that when she looks, she will say, oh, yeah, when I went on the show, I started getting customers. I thank you for her life, for her family, the life of her family. I bless her a grandchild, oh Lord. Bless her coming, bless her going, bless everything that her hands finds to do, and bless our week, as I have prayed in Jesus' name. Amen.
Amen.
Amen. Miss
Amen.
Calloway, thank
Amen.
you.
You're
Thank you.
welcome. Have
I
a
will
good
see you
night.
on the
I'll,
15th. Bye
I'll
bye.
see you soon. Bye bye.
Thank you. Bye.
Bye.